السلام عليكم ورحمة الله وبركاته. أنا اسمي Jorge Pulgarin. أنا طبيب متخصص في الطب الوظيفي. My name is Dr. Jorge Pulgarin. I'm a specialist in functional medicine, and today I will be teaching you about how to have a safe Ramadan. Stay with me. Okay, Ramadan, the 9th month of the Islamic calendar, is considered the holy month of the year for Muslims because it commemorates the revelation of the Holy Quran. Muslims fast from sunrise after the last meal or suhoor to sunset when they take the first meal or iftar. So they fast between 11 to 16 hours depending on the time of the year and geographical location for a period of 29 to 30 days. During this period, Muslims train themselves both physically and spiritually, signifying a state of constant awareness of God. From this awareness, a person should gain discipline, patience, self-restraint, compassion with poor people who are in need, and a greater incentive to do good and avoid doing wrong. During this month, Muslims attempt to read the entire Quran book and to recite it completely during special nightly prayers. There is a group considered unable to fast. It includes menstruating female, some pregnant and nursing women, the sick people, and elderly people and children. At the end of Ramadan, Muslims celebrate one of their major holidays called Eid al-Fitr, or the festival of the breaking of the fast. As I explained in a special post on my Instagram regarding the effect of Ramadan in weight and body composition, of which I will leave you the link below, this Ramadan special video will go a little bit deeper on scientific evidence. But before continuing, please, to support me doing more content like this, give me a like, subscribe, and turn on the bell so you won't miss the new content. Okay, in this first part, I will speak about the knowledge of changes in the body during Ramadan and how to reduce potential complications in health. According to scientific literature, the changes that the body experiences during any kind of fasting should not be underestimated. A lack of knowledge on the nutritional needs or the improper performance of fasting, particularly in relation to the time, type, and amount of food intake, can cause disorders such as indigestion, bloating, constipation, headaches, among others. According to scientific literature, the changes that the body experiences during any kind of fasting should not be underestimated. A lack of knowledge of the nutritional needs or the improper performance of fasting, particularly in relation to the time, type, and amount of food intake, can cause disorders such as indigestion, bloating, constipation, headache, among others. I personally practice intermittent fasting many times during the year. There are many different protocols to perform fasting, and I have been studying them since many years ago. Each protocol has its own particular considerations. Fasting can be classified as wet fasting when the person has access to drink water, or dry when there is water restriction. Restricting water intake has many more repercussions than fasting from food. The fasting of food and water performed during Ramadan by Muslims resembles an intermittent dry fasting performed by non-Muslims, as it has the same biological correlations. Regarding to Ramadan fasting in 2016, there was a prospective observational study that assessed the general knowledge of a group of 600 fasting and 588 non-fasting individuals regarding their knowledge about the suitable and unsuitable food both for Sahar and Iftar, the liquid intake and body liquid restoration, and the food that increased gastric symptoms like hunger, heartburn, constipation, flatulence, also the food that increased the feeling of thirst, hypotension, headache, hypoglycemia, and the ways to prevent it, and finally the alterations regarding sleep quality. A low knowledge level was observed in the connection with which foods increase hunger and reduce blood glucose during fasting. Also, only a small percentage of participants were aware of the glucose-lowering effects and consequent hunger effects of sweets eaten at Sahar. Regarding hydration, fluid intake, and food to break the fast, there was a good general knowledge. An excellent knowledge to avoid fatty food for the Sahar was also evident. Despite the knowledge, all the considered complications increased between 16 to 35% during Ramadan fasting. The study evidenced an increase in all gastric symptoms and alterations, and also alterations in the sleeping pattern. Belching, bloating, and plenitude feeling were the most frequent symptoms described in the study. High physical activity and the coincidence with a warm season are factors that can increase the feeling of thirst and potential dehydration during Ramadan. The study suggests to avoid intense activity during the daytime, consume an adequate amount of fluids from sunset to dawn, and to alleviate thirst, the study suggests to eat fruits and vegetables, especially during iftar and sahar. The intake of low amounts of fever can produce more feeling of hunger and thirst. If the sahar contains a large amount of proteins, fats, salts, and spicy food, the probability of thirst will also increase. There is a special mention that a low amount of fever and a large amount of calories, and in the study they mention more than 70% of carbohydrates, which I think it's just too much, can produce a high insulin peak and a consequent hypoglycemic episode, and for the same reason, also more hunger sensation during the day. The study also recommends avoiding overeating to reduce bloating, fullness, and heaviness. This means that they advise to consume low volumes of food, sweets, carbonated beverages, and excess of fried foods. Bulky food intake at iftar can be associated with gastroesophageal reflux and heartburn. Food that delays gastric emptying, like fried food, can also increase the reflux. Constipation and bloating can be related to low fiber intake and changes in the sleep pattern and reduced physical activity during the day. Regarding changes in sleep pattern, normal sleep onset is associated with a rapid core body temperature decrease. Whatever increases the body temperature will affect the sleep quality. Thus, the thermogenic effect of food can impact directly over the onset and maintenance of sleep. This means that more calories taken, less temperature decrease, and worse sleep quality. This could increase the feeling of tiredness and also the levels of stress during the day. Headaches are related to hypoglycemia, withdrawal of caffeine, changes in sleep quality, and stress. According to the study, the probability is higher in people that have previous story of headaches and migraines, smokers, and the ones that drink more than 5 cups of coffee per day. Regarding this issue, the study suggests reducing tea, coffee, and smoking 2 weeks before starting Ramadan. Okay, I will move now to the second part of this video. Pre-Ramadan consultation, is it a good practice? Well, this topic is fundamental. A leading belief in Islam is to avoid self-harm. Despite this, studies reveal that numerous Muslims around the world with chronic diseases opt to fast during Ramadan despite uncontrolled medical conditions. For example, there was a survey that included 12,000 diabetic Muslim patients. 79% of them decided to fast despite having uncontrolled diabetes. According to recommendations on scientific literature, a Ramadan consultation 1 to 4 months before can be a beneficial approach to optimize the care of the patients with chronic conditions, considering that Ramadan fasting represents a challenge not only for the Muslim patients but also for their healthcare providers. And precisely regarding this issue, I found a very interesting study published in 2023, and I want to highlight that this study was the first of its kind. Before it, no study has been designed to assess the uptake of a pre-Ramadan consultation guidelines. The latest guidelines about pre-Ramadan consultations were published in the British Medical Journal in 2022. Unfortunately, the access of these guidelines is not free. The study aimed to assess healthcare professionals on the fields of family medicine, general practitioners, internal medicine, gynecology, and obstetrics 3 factors: knowledge, attitude, and practice towards a pre-Ramadan counseling in some of the Arab countries, and assessed the effects of the physician's specialty and religious beliefs on these 3 factors. According to its findings, the majority of the participants, 84%, didn't receive a pre-Ramadan consultation training. Family physicians were the most knowledgeable in pre-Ramadan consultation compared to the other specialties. Interestingly, religious backgrounds didn't influence physicians' knowledge scores, but non-Muslim doctors got lower scores in attitude and practice compared to Muslim doctors. To conclude, the study presents a novel perspective. Pre-Ramadan consultation is underutilized across the medical specialties, which carries a substantial risk for patients with chronic diseases who wish to start doing fasting during Ramadan. It suggests that improving the physician's pre-Ramadan consultation knowledge will help them to optimize the care of the patients before Ramadan. Moreover, improving the attitude and practice of non-Muslim physicians is required to enrich the approach centered on the patient. Considering the gaps in literature, this study invites to do further research on the topic. Taking the information provided by this study, you or your relatives should go to a pre-Ramadan consultations if you have one of the following criteria. If you are taking specialist prescribed medication, if you have a reduced life expectancy, if you are undergoing any oncological treatment, or if there is uncertainty for you if it's safe or not to start doing the fasting during Ramadan. This consultation will serve to do a shared decision between you and your doctor to determine if it's safe to do or no the fasting. Also, to determine the safer options regarding the administration of your chronic medication and how to reduce the risk of dehydration, and also to determine and review what can constitute an adequate nutrition for your particular condition. If deterioration, disease exacerbation, or delayed recovery occurs during the fasting regarding your chronic condition while you are during Ramadan month, the guidelines advise to break the fasting and seek immediate medical counseling and consultation to prevent further complications. Okay, and this has been all of the information that I consider that can be of help for you and your family to have a safe Ramadan. Again, if you like my content, please give me a like, follow me, and activate the bell so you won't miss the new content that I will be posting. Thank you so much and God bless you. Bye.